Okay, let's see more from Simeon.
You foreshadowed in a cabinet paper in March this year the need for a capital injection if Health New Zealand can't make cuts. So why won't you admit it here that this budget is unrealistic for maintaining service delivery?
I'll ask Jaime Balka to answer that. So, Mr. Chair, analysis was done with the Treasury to agree a cash position for Health New Zealand, and that position has been agreed. Health New Zealand has a deficit track ahead of 200 million. If that deficit track was changed to zero, well, they'd need another $200 million. But the deficit track
this
is
guy, the expert that couldn't even answer a question.
Equity support if needed to cover that.
Yeah, it's $900 million less than where this year ends.
$1.37 billion uplift in this year's budget, which we're focusing on delivery for patients, including elective boost.
Almost reviewed by the deficit. The next supplementary is when staff at Middlemore saw a $3.6 million funding increase, what did officials prioritise? Saving lives in that emergency department or saving money to fix Health New Zealand's deficit?
Well, the advice I've received is that that request didn't go to the Health New Zealand board, but what has been delivered is a number of initiatives to provide more support to Middlemore, including opening up additional beds, putting in more clinicians into the emergency department to provide more support during winter so that we can continue to see patients and ensure they get timely, quality access to healthcare, and that's the focus.
Nowhere near what is needed.
And that's the focus.
An unsafe department.
And that is the focus that I'm bringing as Minister of Health, is making sure that the organisation delivers for patients.
Yeah, delivery.
Thank you. We've got 2 minutes left. It's all with her, Hannah.
Thank you. Minister, I heard from a nurse in Whakatane Hospital following a comms that came from the Deputy CEO for Manuataki on the 13th of June, and she was frustrated. She shared, how can any of these health targets be met if basic resourcing needs for our community and hospital are not being met? She shared that kaimahi are burning out mentally and physically. She shared community health needs are deteriorating and more complex. She asked for more attention on rural health and resourcing, and where is the national plan to guide implementation moving forward and to enhance services? So what do we say to kaimahi who come to us that are tired, that are stressed and stretched, knowing that there is under-resourcing like in Whakatane Hospital?
Well, the answer to that question, and firstly, we are incredibly grateful for the work that is undertaken by all of our healthcare workforce across New Zealand, and we're very focused on making sure we're investing in more frontline staff. Health New Zealand had nearly 1,689 more frontline staff as at 30th of December 2024 compared to the 30th of December 2023. We are focused on investing in frontline services, frontline workforce, so that we can do more for patients and deliver more for patients. That number again is 1,689 more frontline staff as at 30th of December 2024 compared to the 30th of December 2023. We are investing in our frontline health workforce.
So, Minister, I have a frontline staff member contacting me saying shorter stays in emergency departments. How can this be achieved when they're understaffed? They're under-recruited and they're under-rostered. There's no sick leave cover available. They're working so hard and they're stretched. Then they go over to first specialist appointments. How can this be achieved when there's not enough doctors or specialist nurses compared to the amount of patients who are waiting for their first appointments? There's a large array of concerns from the front line.
And there's always a requirement to invest in more frontline staff, and I wish the previous government hadn't focused on rearranging bureaucracy and actually focused on frontline staff during their time. That's what we're focused on.
You were complaining we hired too many nurses.
Thank you, everyone who has joined us today. We appreciate your time.
Well, what happened to Leicester?
Where's Leicester?
Yeah.
Okay.
Where is he? Oh, you cannot have a functioning health system with just frontline staff. You need the people working behind the scenes, the people doing the paperwork. Yep. You can't cut 30% of your IT staff and expect these shitty old systems from like the early
running Windows 95.
Yeah, to keep freaking running. Like I've interacted with some of these systems. I worked in healthcare IT. I know how bad it is. Yep. I worked, and this was actually private healthcare. I worked on a budget of $0. Like I was just sticking old shit together, making old laptops. Like I had to replace parts, make them come back to life. Just changing parts from all other broken laptops. There was no budget there.
When's this the same, isn't it? I've seen their kit. Holy shit!
And I was at that protest outside the Auckland Hospital, and they're all saying the same thing. We need more IT staff. We need better systems. We need more people to do administration because a lot of these doctors are now having to do a lot of their own secretary paperwork because according to Labour, it's bad cost efficiency to pay a secretary to go and do all the paperwork and fill out the spreadsheets and Word documents, even though that takes up a shit ton of time.
Yeah, I mean, why are they going to Australia? Probably because they have backroom staff over there that does a lot of this work for them.
Yeah,
For starters.
it's just ludicrously stupid, like sitting there and saying that, it's like sometimes you just need backroom staff to make shit work. Well, I can tell you this right now. It's in the ballot when we do the shows going on there. We cannot function on any less than 5 people.
Yeah.
I mean, we've managed to during a normal show tour, we cannot function on that. Now, I do know that for a by-election, Nick and I got into a situation where literally we had to rope in an audience member to be the question host.
Yep.
Yeah, that went quite well. But literally, and it was one of the weirdest shows of literally running on 2 people. Now, we turned up to the venue an hour before we were meant to turn up, to set up. Because we just didn't know what it was going to do, because we weren't able to do our normal layout to how we normally do it, because Nick had to sit down there and have one hand on a stream deck and another hand on a camera tripod and sit there and do it. It got pulled off very well. But
for a show, that's fine. We should not expect that from the medical sector.
No, exactly.
Hell no. Right? I don't want a nurse running around doing millions of paperwork while there's someone dying. Like, that's I don't want that.
I'll help you in just a second. I just got to fill out this paperwork. Hold up.
Yeah, just got to make all these phone calls, and I just got to deal with this broken computer over here, and I got to deal. Like, no, come on.
It's like it won't print to the printer again.
Like, why? I mean, basically, what this government's asking nurses and doctors to do with all these pay cuts is, can you work more for less? No. Why would they do that? They want the same pay with the same amount of work that they're doing before. Preferably, they want better work conditions. I know that much. They want to be less on their feet and be able to take a break once in a blue moon. But they can't even do that because they're so damn overworked because the government's underfunded healthcare. Of course, they're going to go to Australia.
I believe it's on average, it's about 15% more work they're expected to do with a pay rise of 0.8%, I think it was, wasn't it? Yeah, and inflation of 2.5%.
But they're greedy. They want more money.
Now imagine if you told your car, hey, you've got to use 20% less fuel, but you must keep doing 100 kilometres an hour. And I want you to use the fuel of driving State Highway 59, but I want you to deliver the time savings of driving over Transmission Gully. It ain't going to happen.
No.
It ain't going to happen. I'm not sure. What's the Auckland equivalent of, what do you call it, Transmission Gully and the old Pukekohe Bay Road? I was going to say, because they really have it. Once you get, was it south of Rainbow's Head, there's only State Highway 1 until you get the bottom of the Bombays.
At least Shane Hereti, as much as I disagreed with him on so many different things, at least the man acknowledged there was a damn limit. Simeon Brown has no fucking clue.
Yeah, that's true.
That's the difference between those two. That's the difference between having a doctor and a wannabe banker.
Wannabe banker. Yeah, a wannabe banker who's an anti-abortionist.
Yeah. So you know who's going to have a much more accurate understanding of how the medical sector works. Right? It's the guy who's worked as a doctor.
Yeah, exactly. Yeah. Ironically, how ironic.
Oh my god! Like my dad, he worked as an optometrist for 30 years, right, for retiring. He's pulling his hair out. Like, he remembers the days of Ruth Richardson, right? That's how old my dad is. I found it so funny in that discussion she had with Jack Tate. Tim the taxpayer, that's literally my dad. My dad is Tim the taxpayer. Tim White's optometrist, for those that are old enough to remember, in Upper Hutt. That was his clinic down Astral Towers. Now, Tim, the taxpayer, couldn't stand fucking Ruth Richardson because all the cuts she made resulted in poorer health outcomes that my dad had to often pick up the pieces for when it came to eye care.
Yeah. Now I want to ask, was Guppy's Pharmacy around when your dad was an optometrist in Upper Hutt?
Quite possibly. I know that my grandparents ran a pharmacy out of Upper Hutt towards when he was beginning his optometry career.
Because if anyone's in Upper Hutt,
Yep.
you know, Wayne Guppy is not just known as being the mayor forever, he was also known as the local pharmacist for even longer. And I think his wife is still actually running the pharmacy. I know Wayne, I think, is more committed to the mayoral job. But
but what time period? I'll be able to give you a straight answer. It's probably about 90s to 2000s here.
No, that's so the Guppy. Because he became mayor in the late 90s. I think it was late 90s, but Guppy's Pharmacy was like 20 years before that.
Yeah, no. So not contemporary to my father's time. They would have been contemporary to my grandparents' time, when they were chemists.
And I mean, Guppy's Pharmacy is still there now.
Yeah.
But no, that's Upper Hutt's current mayor.
But yeah, no, I just thought it was really funny how about Ruth Richardson. I was like, oh, yeah, we can talk all about Ruth Richardson and her cuts. And National's doing it again. They've learnt fucking nothing.
The current national government ain't the John Key national government.
No. Yeah,
that is definitely something in there. And I mean, slash and burn. And I mean, here's the thing is, 993, they were in the process of having a hung parliament on the night. And if it wasn't specials, they would have been a hung parliament. But special votes, we one
I was
vote
like
in
3
favour.
years
But
old during the election, so I don't remember.
Yeah, I don't either.
I'm sorry, guys. I don't understand why we're sitting here criticizing this current government. Why are we doing this? We should be criticizing Labour.
Yeah, we should be. Yeah, blame Labour.
Yeah, we should be
I blame
focusing on
Labour.
them.
I blame Labour.
I could have a shopping list of that.
Yeah, no, I blame Labour that I went out to go get this road cone for this show, and there's no Brooke Van Velden. I blame Labour for that. It's their fault.
Damn.
I did all that work. Thanks, Labour.